having this afternoon. Thank you for joining us. Today, we are going to be looking at innovations in the healthcare sector, whereby we are looking at creative innovative solutions to common day challenges. What are some of the innovative solutions that you can bring into the healthcare setup that enables us to work more efficiently and for the better care of our patients? This afternoon, we have Mr. Zakaria Kimengich, Mr. Zakaria Kimengich, who is going to take us through a presentation on innovations in the orthopedic sector. In absentia, we recognize Dr. Peter Kamau Njoroge, who is an orthopedic surgeon in Kenyatta National Hospital. Thank you for joining us. For CPD, kindly email knhcpd@gmail.com or cpdpharmacy@gmail.com if you haven't received your CPD points yet. For this one, you'll get your updates on all the CPD points that you've attended the sessions for. Thank you so much for joining us. I'm Dr. Agnes Karingo Karome from Kenyatta National Hospital. I'll be moderating this session. I now welcome Mr. Zakaria Kimengich to further introduce himself and to take us through one of the innovations that he's been part of and that has really helped in taking care of pediatric patients, orthopedic trauma patients in Kenyatta National Hospital and beyond. Welcome, Zakaria.
Thank you, Daktari. Thank you, the research team. My name is Zakaria Kimengich. Together with me, the Dr. Peter Kamau Njoroge, who is not here, he's doing a surgery somewhere. So today, I'll be able to take you through a creative, innovative solution in health sector. So my presentation, sorry for technical issue. I'm Zakaria Kimengich, an orthopedic and trauma technician with a passion of improving non-operative care in the country and here and beyond. So based in accident and emergency department, whereby I deal with patients who comes in the hospital with bones that are broken. So together with me is Dr. Peter Kamau Njoroge, is also a consultant orthopedic surgeon in Kenyatta National Hospital, who believes that affordable and effective orthopedic care should be available for all. So allow me to take you through a definition of innovation. I believe everybody have a different ways of defining innovation. There are quite a lot of innovation in this country, but basically I'll just be taking you through on health. So definition creation means creation, development, implementation of a new product. That is a definition of innovation with an aim of improving efficiency, effectiveness, or a competitive advantage. Another definition of innovation is coming up with an idea that are relatively easy, fast, and affordable, then those ideas need to be implemented. So this is a brief definition of innovation. I believe many of you participants who are watching, you have also a way of you can be able to define an innovation. So it's important after coming up with an innovation, you need to be able to implement. So what takes up this innovation? This is called a teamwork. When we came up with this innovation in the hospital, I didn't do it alone. I was able to approach Dr. Peter Kamau Njoroge. You can be able to see, he's a consultant orthopedic surgeon in the orthopedic department. So you can be able to see when I saw that challenge, we were able to sit down and be able to draw and be able to come up a way how we can now be able to improve. So teamwork is very important in every organization and in every hospital. Allow me to take you through our first innovation in the hospital. We came up with the hip spiker table. This was 2015, whereby we came up with this table. This is because of frustration in dealing with the lower limb fractures in children. Having worked in Kenyatta for 18 years, I see patients who comes with the bones that are broken, either the lower limb or upper limb, children, and also we also see even the adult. So the biggest challenge is to come up with a simple, easy way, and effective solution. So this hip spiker table, when we came up with it, we were able to see how we can be able to improve lower limb fractures in children. So children are very important because they play a lot. They get fractures. These children need to be managed well because these are the leaders for tomorrow. These are for the leaders for future. So it needs to be managed well so that their bones can be aligned well because they are the leaders for tomorrow to be able to build the nation. So these children need to be managed well and their bones need to be fixed well. A hip spiker table with a double extension traction. So this is the innovation that we came up in 2015. So innovation is a new method of fracture femur and hip management in children below the age of 6 years. Why we came up with this innovation is we actually saw in our day-to-day work, in our day-to-day service, when we see patients, we saw that most of the children with femur, which is our thigh bone, and hip, these are injuries, if they are not managed well, children will be able to end up having really disability or even disabled. So basically this hip spiker table with double extension traction is basically for children with thigh and hip fractures children. Pediatric hip spiker table with extension traction is a tool that is used by orthopedic trauma technician. Most of the hospitals, after the health has been devolved in all 47 counties, you'll be able to see our orthopedic trauma technician. These are the staffs or personnel that are really deal with fractures. They counter first with patients who comes with the bones that are broken. So they are the one who normally manage most of the fractures. And really this hip spiker table is very important for them to be able to manage these children well. So this hip spiker table with extension traction is normally managed used by orthopedic trauma technician. Also orthopedic surgeons, they normally use also to be able to manage these fractures of the thigh and hip fractures in children below the age of 6 years. Basically, this innovation is basically for children below the age of 6 years. Because after 7 years, you can also be able to admit. There are those cases that also need to be admitted. So basically for this table is managing children less than 6 years. So this is the hip spiker table. I don't know whether you can be able to see. Really, the drawing may not be able to show clear, but this is the hip spiker table with a double extension traction. It consists of temporal glass. It has the limb rest, extension shaft, foot rest, and locking wing nuts. So this is the hip spiker table that we came up for managing of children of the thigh and hip fractures in children. So you can now be able to see how that hip spiker table with the double extension traction is. The biggest problem why we came up with this table is because of this massive problem. Apart from other fractures that children get, even in the lower limb, like tibia fracture and also fracture, where we are concentrating is this fracture called the thigh or a femur bone, whereby when a fracture or when a patient gets a fracture, most cases, basically they get what is called the displacement. So this mostly problem is because of the shortening of the femur bone and rotational of malunion. So when the bone breaks, there is always shortening, and that's why it requires to be reduced and to be aligned well. And also you can also be able to get some of the fractures that are getting rotation. And when the bone gets rotate, this fracture, if it's not managed well, it will be able to heal in malalignment or malunion. So really, children need to be managed well, and especially these thigh bone and hip fractures, so that they can now be able to walk and be able to use their limbs well. So this is the biggest mass problem that really we saw, and that's how we came up with this hip spiker table with the double extension traction. Now, allow me to take you through, this is called the existing solution in US. This is the hip spiker table in US, how it normally look like. So that to appreciate the innovation, it's good to see how the existing table look like. This is in US, and the hip spiker table has its own challenge. This one has its own challenge. And to appreciate our own innovation, it's that this one, it does not have the adjustable extension traction to provide counter traction when managing and fixing the femur, thigh, and hip. So you can now be able to see the hip spiker table that is normally in US. It does not have the extension traction. So another challenge that this table has is very expensive to import to Kenya. Actually, approximately, if government of Kenya or any hospital, if any hospital was able to buy this equipment, really you could have, because there is what's called cost, there is what's called handling, and also the shipping, very expensive to buy this equipment. And that's why you can appreciate the government of Kenya when they really be able to buy some of the equipments in the country. So we want to appreciate the government of Kenya for buying some of the equipments so that the county hospitals can now be able to use. So buying these equipments are very important. And that's why it's good to appreciate if we can be able to come up with that innovation, which will be able to reduce this cost. Another challenge about this hip spiker table, it does not have the footrest to increase the comfort of the patient. So if you try to see this table, that's how it normally look like. Even if you have to buy, or any institution has to buy this, that's how now this hip spiker table look like. It does not have really footrest. So those are the challenges. And to appreciate our innovation in Kenya, this is the Kenya improved model. So this is how we came up with, you can be able to appreciate, this is our Kenyan improved model. And also in this side, this is the US basic model. You can be able to appreciate our innovation. The problem we saw to address this, day to day when we see these patients who come in the hospital, the biggest problem we saw was deformity and long-term disability. Because we didn't have the right equipment, really most of the children will end up having deformity. And having this deformity will be able to lead to a long-term disability. So that's why we came up with this innovation. So that is one of the problems to address. Another problem is the increased pain during spiker cast. Just to take you through that, most cases when children comes with fracture femur or thigh, we normally apply what is called the hip spiker cast. This is the cast that are normally applied after the bone has been reduced and after the bone has been aligned. Then you're able to apply the hip spiker cast. So this is the increased pain because we didn't have the right equipment. So children will end up having a lot of pain. Another problem we also saw that unnecessary admission to the ward. Most of the children, if not aligned well, or if it's not managed well, most of the children will end up being admitted, which is very expensive to really parents and even to the relatives. Very expensive admitting because this child has to be in the ward probably maybe 4 weeks, 6 weeks, which is very expensive. And if maybe some of the parents or some of the relatives, they don't have this NHIF insurance, will really be able to be very expensive, and especially in this developing country. Another problem is high health cost. I've actually mentioned that because of admitting, we'll be able to end up having parents to be able to pay. very high and very expensive. So allow me to take you through, these are the current methods used on children below the age of 6 years. These are some of the examples that are method normally used. When a child comes, you are able to position. You can now be able to see this. It's called the spica crest. This is what we've been using it even in the hospital since 1950. Actually, even I think most of us were not born and understand was being used. Orthopedic used to be in Kabete Loa. So this was what was being used by our first plaster technician to be able to position the child so that I can now be able to apply the hip spica cast. So it's really a challenge and it's really a big problem. So this is a big thing. Also jerrycans, they're normally used because of lack of equipment or lack of the tool. You'll be able to see some of these hospital because they don't have the right tool. They're able to improvise using even the jerrycan. So there is need of coming up with the innovation. This is also other method normally used because of lack of tool or equipment. Really, some just to get anything like a paper or wooden to be able to position that child so that at least you can now be able to apply the spica cast. So, and this become a very big problem and a challenge. You cannot be able to align the bone when you have such kind of improvisation. You can also see using of the container. These are some of the tools. Because of lack of the tool, they normally use those containers. Really, also you can also be able to see, these are some of the pictures. I was actually being sent by most of the county hospital in level 5, level 4, and level 3. So really there is a big gap, there is a big challenge, and that's why there is need of everyone to be able to come up with this innovation so that we can now be able to improve management of children below the age of 6 years. You can be able to see that that is an eco-metallic tool. Really, a child is very uncomfortable. Also, you can now be able to see, this is also lifting the baby. When a child broke because of the lack of the tool, you need to be able to lift so that the bone can be aligned and then the spica cast can be applied. So it's a big problem, it's a big challenge. And that's how we came up with this innovation so that to be able to improve in management in children below the age of 6 years. This an idea came. Now, having such a problem and having such a big challenge that most of the hospital and even us, we were using it. Now, an idea came called the hip spica table. So you can now be able to see that is me together with Dr. Peter Kamau Njoroge, coming up with the design way how we can now be able to come up with a hip spica table with an extension traction. So teamwork is very important in every institution, in every organization, in every hospital. You cannot be able to do it alone. You have to have a teamwork. You have to have a team. Share idea. When you come up with an idea, when you come up with anything, share so that at least you can now be able to improve, especially our health sector, which has already been dissolved. Allow me to take you through the involvement of the hip spica table. It's good to know where we came up. This is the fabricated the spica table in 2015. I want to appreciate when I went to Kijabi for a 3-day training, I was able to see a table like this. You know, Kijabi is one of the hospitals that really most orthopedic cases normally done, and most of the projects of orthopedics. So when I was there having a training for 3 days about Ponset, I saw this tool and I was able to take a photo and came up to the hospital. We were able to fabricate this. That was in 2015. It was very exciting and very impressive to see compared to what we were using it before. So in 2015, 2016, we were able to use this table, and still, we were still able to see the challenge, because when you come up with something, after using it, you see the problem. So we were able to improve. Now in 2017, we now invented hip spica table with a single extension traction. So I was able to approach Dr. Peter Kamau Njoroge, who is an orthopedic surgeon, and now be able to improve from the previous to now this called the single hip spiker table. So you can now be able to see quite different. So we improved even to be stainless, because you see most of the hospital or most of the medical tools are normally using stainless. So we're able to improve to a single extension traction. And then in 2018 and 2018, now we were able to improve more better, because one, we want to make sure that we are able to improve and be able to manage fractures even when the children comes with both limbs. Because most of the times when children comes, you can either get one of the part of the limb, and sometimes you can get both limbs when the bone breaks. So if both limbs breaks, and really it's important to have this, and that's how we were able to improve and came up with a double extension hip spiker table in 2017 and 2018. So we've used it. It's an amazing machine, and we've seen really improvement. Allow me to take you through. This is when we came up with this double extension traction. You can now be able to see this is one of the patients who came with a fracture femur. It's more comfortable compared to before. You are able to use you need like 4 to 3 personnel to be able to apply. But now with this one person sufficient, you can now be able to just position the child. You can impress. Technology is very important, and it is good to impress technology. It's really improved in terms of managing of any cases, especially in medical. So you can now be able to see, this is me. I was able to apply when we came up with this double extension traction. And my colleagues still, personnel is still very important. Even if still having this equipment, you still need to have personnel because it's a teamwork. These are a few cases of the patients we've done in the hospital. This is a child who came with a fracture femur, and we were able to use the hip spiker table. You can now be able to see this is a femur fracture that is called a distal. Ideally, this child was to be admitted, but just because of impressing the innovation, we were able to use the table, and we were able to apply and be able to discharge this child, and the parents were happy. So this is the check X-ray. You can now be able to see that's the check X-ray. A reduction was achieved after the check X-ray was done. So we normally do before and after just to confirm the reduction. Solution, when we came up with this hip spiker table with a double extension, a lot of advantage, a lot of solution. We can impress, we can appreciate this innovation, because when we came up with this, one, we are now able to reduce deformity. That is the biggest thing. Now we're able to reduce deformity because of optimal bone alignment. Because of aligning the bone, we are now able to reduce deformity. So nowadays, because of the innovation of hip spiker table with extension traction, we've reduced the deformity. Secondly, we've reduced the pain during the spiker cast. Actually, the pain has really reduced. Another solution that about the table has reduced admission to the wards and less surgical procedure on the patient. When this innovation we came up, we've really reduced in terms of admission, and also even in terms of surgical procedure, we've really reduced. And lower health cost of the family has really also gone down, because most of the now these cases, we're able to manage, we're able to apply the hip spiker cast and be able to discharge at outpatient. And then now the patients, the parents are able now to go with their child and be able to take care of this child at the home. So it has really lowered down the health cost for the family. Another important of this solution is it's a comfort position of the body. Now it's more comfortable. If you try to see, because now we have the double extension traction, it's more comfortable when now managing these femur and hip fractures. Very important thing is also we are able to allow the adjustment of the position of the foot. So the beauty of this innovation, now we're able to adjust any position of the foot, so that now we can now be able to align and be able to put the hip spiker cast. So far, progress is good to know. Since we came up with this innovation, we've made what is called a prototype table. We've made a version 2. And actually, we've been able to use for the last 2 years in Kenyatta National Hospital. It's an amazing machine. We've been able to present over 10 conferences here in Kenya and even outside. It's an amazing, because when we came up with this, I've been able to present within and outside the country. We've been done what's called the file patents for an extension traction. We've also identified a local, manufactured and ready. Actually, now this table, we are able to make it locally. There is no more of shipping or importing it. We've identified a local company. We are able to use it, our local materials, and it's affordable and it's very cheap. So we've been able to donate this hip spiker table to 5 hospitals. So we've made 5 tables and we've been able to donate this hip spiker table. When we came up with this hip spiker table, we've been able to make 5 and be able to donate to 5 hospitals within our hospital. Kenyatta Hospital being the referral hospital, we get patients from other counties. So we were able to donate to Mbagathi Hospital, Mama Lucy Hospital, Thika Hospital, and also one of the hospitals, Spine Orthopedic, and the one that we are using in the hospital, so that this hospital within the hospital can now be able to manage this hospital, these patients at the hospital level. So we were able to donate and be able to train them on how to use this hip spiker table. This is the donation that took place. This was in 2018. It was in a safari park, whereby we were able to invite those hospitals and their med soup and also orthopedic trauma, can be able to see, whereby all the innovation, actually this was an innovation week, whereby all the innovators were able to invite it. So we were able to use this chance to be able to donate to those hospitals, and they were able to receive the hip spiker table with extension traction. So now they're able to use, and now they're managing those fractures. We've reduced patients getting referred to Kenyatta Hospital. So far, there are few success. There are many success actually stories. Having used this table, the impact of the innovation to lives of both children and parents, they've been very successful. We've been able to manage these children. Most of them are able now to go back to school. They're able to play. So these are few success stories, and we've done quite good, a lot of stories we've done. Below are also some of the success stories after using the hip spiker table with the double extension traction. So allow me to take you through, these are a few cases to be able to show you how the fractures, this is one of the fractures we were able to use. This is a fracture femur. A child came with the 4 years who fell, and we were able to use the hip spiker table. And now you can now be able to use, we were able to achieve the bone alignment. And this is 1 year down the line. We like following to see the impact and also how is the progress. So you can now be able to see, these are some of the tests. We like to test to see how is this child, is able to flex, is able to extend. So this is results after 1 year. It's an amazing machine. This is also another child who came with a fracture femur. You can now be able to see this is a fracture femur that the child came. And you see, it's very difficult if you don't have the hip spiker table, or when you don't have the right tool, become very difficult to be able to manage such a fractures. And down the line, you can now be able to see this girl is running, is playing around because of the innovation. And now the child is back to school, is able to play and be able to do all what is expected to do. So this innovation is an amazing. And also another one, this is also another femur. Just a few can be able to see, we've been able to align. This is another boy is able to play. And now we're able to follow after 1 year. So we like following our patients just to see the progress and also the impact of this innovation. Innovation number 2. When the COVID struck the country, this was in March, especially the global, we also thought of coming up with also other solution to be able to solve our local problem. This is called the food operated hand sanitizer stand. So this is an innovation we also came up when the COVID struck the country. This is the food operated hand sanitizer stand. That is this innovation also we came up with. And you can also be able to see when the Ministry of Health say people need to sanitize, people need to wash their hands, people need to face masks, and people need to social distance. So when you try to see this is people normally use, you can be able to see normally people normally sanitize You can be able to use it, pressing it, using the same, and almost like 100 or 200 people using the same. But now with the innovation, you no longer need to use the hands. And also you can be able to see that. Now, what led to this innovation is this innovation has been developed in response to COVID-19 pandemic. Sanitization has been highly utilized, especially in organization and area within the high traffic of people, such as hospital, business premises, shops, and shopping mall. Most available sanitation devices require individual to dispense the sanitizer by pressing on the adjust valve on the bottle, which can easily lead to the cross infection. This is very important. Because of using the same container, which will be able to, and most people normally use, it will be able to lead to cross contamination. Because of the high number of the individuals that are sanitizing at one point in time, this innovation has been developed to control such a viral as well as the bacterial cross infection. So we came up with that so that it can now be able to reduce. So the foot-operated hand sanitizer stand is made up of the stainless steel, and it is the durable and strong, which makes it perfect for the public places. And the unit is designed that is an adjustable and adapt to different bottles sizes, both in length and diameter. It is easy to clean because it is a stainless. It can be wall-mounted, freestanding. Therefore, this foot-operated sanitizer has come up that will handle in fight of COVID-19 pandemic, and even after, you know, the beauty will never even be able to use even after this pandemic. The purpose for this innovation is to control and spread of the coronavirus from an infected person to another while using the same sanitizer bottle. So benefit for using foot-operated hand sanitizer and hand wash. Actually, we came up with a foot-operated hand sanitizer and hand wash. So one, because of this benefit is reduction of cross-infection from one person to another one. Another benefit is they does not require electricity or battery. So this one does not require because electricity is very expensive. And in some places where electricity has not reached, so this foot-operated hand sanitizer and hand wash, because of you don't need electricity, will be able to actually be used to control this coronavirus. The stand can be used in different indoors and outdoor settings at entries, offices, companies, schools, and also the people can self-dispense as and when they need to. So the dispenser stand support head is fitted with a stainless steel, prongs on the left and the right. To the set, the utilized is nozzle. The difference why we came up is the nozzle at 45 degrees. This is a crucial and the unique design, only one of its kind, to prevent splitting of the liquid on the shoes or even the foot of the user. So why we came up with this foot-operated hand sanitizer and hand wash is so that at least we can now be able to reduce. This is now the innovation number 3, is almost finished. Foot-operated hand wash station. This is also very important. We also came up with that. These are some of the pictures you can now be able to see. Foot-operated hand wash station. They're using the foot bundle. Then these are some of the photos. Really, it's a big challenge. Some foot-operated hand wash station in the market. When this COVID struck the country, now people came up with a lot of innovation so that we can now be able to reduce. So these are some of the innovation that some people came up in the country. So, and the challenge. Now, having seen this, what people came up with, we found with what is available, it's uncomfortable to use, cross-contamination on pressing the soap dispenser on the taps, widely separated soap and water foot bundle when they are unveiled, poor ergonomic and the posture. So these are some of the challenges we saw, and that's how we came up with a unique foot-operated hand wash station. So this is also an example. It's a challenge because this is a person you can be able to see is opening that tap, and still after even cleaning the hand, he will be able to close. So still challenge of cross-contamination still will be there. So our innovation is height and adjusted for the best posture and easy for to be used. Soap and stand pedal operated by the right foot, making it very easy to use. The sign and multiple configuration in all social distance carefully calculated. So that is why we came up after we saw such a big challenge. Now, these are some of the design. When we saw a challenge, you can be able to see you can see the foot pedal and the soap, it is in the same. But when you try to see the previous one, you can be able to see you have to press this right and the other one side. So this is also another design. We came up with the 2 basin. You can also come up with 4. And also, when I came up with this innovation, I got a privilege to be participated in UK. I was able to participate in UK Royal Academy of Engineering. We were around 14 of us who traveled to Kenya, others with various innovation, and we were able to present 2 weeks. We were able to be taken through weeks, very intensive training at the Royal Academy of Engineering for 2 weeks. And thereafter, there was a final pitch presentation whereby each and everyone, we were able to meet other innovators from Turkey, South Africa, and everyone was able to give a pitch, a final presentation. And good lucky, I could not believe, our innovation was the first position. I was able to get the first position in London. And also I was able, of course, everybody when you participate in any training, so you are given a completion of certificate. So I was able to get the first position in London, having the best. Those are certificate I was able to get at the UK. So this is me, I was #1. Second was a lady from South Africa. And also this was also a gentleman from Turkey, was #3. So our goal, why we came up with this innovation, the hip spiker table with double extension, is every hospital to be able to have this hip spiker table locally, and also we are looking forward even to have it internationally. And also foot operated hand sanitizer stand and hand wash station, actually to be installed in all institutions, especially now the schools and mostly institutions are able to be open. So it's very important to be able to install these things because it will be used even after this pandemic. Our future is to expand to other countries. Allow me to appreciate the University of Nairobi and also Kenyatta National Hospital, the committee, for allowing us to be able to present this innovation in health. Allow me to appreciate also the CEO of Kenyatta National Hospital and the management for this opportunity they've given us to be able to present, and also appreciating the innovation. Allow me to appreciate the HOD of orthopedic and also orthopedic trauma team in KNH, orthopedic surgeon fraternity. Ministry of Health have been very supportive. And also allow me to appreciate Dr. Peter Kamau Njoroge for his mentorship and innovative mind. Become a solution to a problem. Lastly, a challenge is there. Of course, when you come up with any innovation, always challenges are there. Most of the employees are not empowered to innovate. So it's very important to be able to empower. Actually, I want to appreciate I've been in my institution or Kenyatta National Hospital, they've really empowered most of the innovators. So most employees are not motivated. So it's good to motivate so that many can be able to come up with innovation. Not only in health, actually there's quite a good number of innovation in this country. Lack of collaboration also is also another challenge. And also most of the innovation is centralized in one functioning group. So those are the challenge, and thank you for giving us that time. Okay, Daktari.
Thank you very much, Mr. Zakaria. I've really been impressed with the work that you've done, and it has really solved a number of problems that we've experienced before. Allow me to say congratulations for taking that first position and even for putting Kenyatta National Hospital on the map in regards to innovation. Thank you very much. We really appreciate that. Maybe to start us off with the discussions, for our participants, thank you for joining us. Kindly put your comments, your questions in the Q&A section, and we'll be able to answer them and go through them and have a discussion in regards to innovation in healthcare. For those who joined in a bit later, we've had Mr. Zakaria Kimengich from Kenyatta National Hospital, a senior orthopedic technician, who has come up with who has been involved in coming up with a number of innovations in the healthcare sector. He has taken us through 3 presentations, whereby we've had the hip spiker table, that helps in the reduction of fractures in pediatric children. We've had another innovation, and which has been a quick response to the COVID-19 pandemic, whereby we have the foot-operated hand sanitizer and foot-operated hand wash station. And I'm glad that I've been a part of this in experiencing this innovation myself. So just to start us off, maybe Mr. Zakaria, you can tell us, for those who are wondering where to start with their innovation, maybe they have a problem in the hospital, they have this idea. What is the process like from the idea stage? What is the process like to just from the idea stage to the implementation stage and finally having the innovation in place? What would you tell these young innovators or innovators?
Thank you, Daktari, for that's a good question. When I came up with this innovation, that was in 2015, 2016, and all across. You see, I believe everybody, where you are, either you are a nurse, a doctor, or anybody, even in any place, having worked in a certain place, you must have identified a problem. Maybe you see something like now when I came up with this hip spiker table, because of managing children with broken bones, and so the kind of the tools that we were using, and so actually this was not the right tool. So an idea, you see, when you want to come up, an idea has to come up. You see a problem, then you come up with an idea that, okay, these things were supposed to be done like this. So that is called the creativity. So when you see a problem, you are now able to think that, okay, this was supposed to be done like this. So when you have such kind of an idea, it's very important to be able to share it. Like now when I came up with this hip spiker table with an extension traction. So whatever we were using it was not really a good tool to be able to manage fracture femurs. So I was able to share with Daktari, Peter Kamau Njoroge, and then the Daktari was able to tell me, Zakaria, I think we cannot be able to improve because the bones were not aligned. We can improve this, whatever you're using it, and be able to improvise and come up with this. So it's good to be able to share whatever you have it, creativity, have a creative mind, that idea, and now when you came up with that creativity, then now be able to share. Then the important thing when you come up with any idea, important thing is to be able to implement. Actually, the biggest thing is that anybody can have an idea and as a solution can be an innovation, can be an innovator. But the biggest thing is how to implement. So I would like to encourage the participant that when you come up with any idea, please share it and be able to implement. Like now, when we came up with this hip spiker table, we were able to implement and came up with a good hip spiker table with an extension traction. In fact, that is not even enough. We are still improving the table to be a version 3. Thank you, Daktari.
Thank you very much, Zakaria. Indeed, what I'm learning here is that there's always room for improvement, and what we have in use right now, you can always improve on it to deliver better care to our patients. Maybe you can tell us, there are 2 questions here in regards to where can we find the innovation? How can the other facility be able to plug in and be able to use this hip spiker table? Where can they be able to get the same?
Okay, thank you. This is where the innovation came, started at Kenyatta National Hospital, and that is whereby we were able to fabricate, and now from there we were able now to improve. So having came up with this hip spiker table, we were able to identify a local company that is able now to be able to manufacture this. Now, we no longer now need to import this equipment. It's here in Kenya. It's now here with us. We no longer need to go very far. We've identified a company called the Zakam Orthopedic Company, whereby we are able now to have a mass production, produce this spiker table. This is a company that has an engineer. We are working with, actually, this is a company that has a very high profession team, whereby the engineer is there, mechanical team is there. So you cannot be able to get this locally here in Kenya. We no longer need now to be imported. And this is a very good innovation that whole hospital can really be able to have this hip spiker table so that they can now be able to manage, because there is a big challenge in managing fracture femurs in children. So I wish and I would like to encourage at least that to appreciate and to be able to embrace this innovation so that each and every hospital can be able to have, get this hip spiker table. Actually, why we came up with this is for it to be affordable and to be accessible. That is a very important thing, affordable and accessible, because when you try to see how to be able to import it was very expensive. So you can now be able to get at the Zakam Orthopedic Company, whereby you can be able to get at a very affordable and accessible.
Thank you. Thank you. Now here that we have the hip spiker tables and you can be able to get it locally and order it locally, the manufacturing for that. The other comment here is from Charles Ombati. Is it possible to send the information on new innovations to counties? I know, Mr. Zakaria, you're doing a lot of collaborations with even the other county hospitals. How, in which ways can we be able to partner with them, get the information out to them that we have these new innovations, and even then when they have the information, how are we able to support them so that they can be able to move far, just as you have done with the hip spiker and the other innovations?
Yeah, thank you, Dr. for that. We've been able to actually request the Minister of Health, because this is the mother of the health, to be able to adopt this innovation. And when the Minister of Health be able to adopt this innovation, now it will be able to be rolled now to all the 47 counties, so that each and every hospital, like now the governors, CSC can be able to have this information, get to know where this hip spiker table can be able to get. So it's important. We are aligning with the Minister of Health so that they can now be able to adopt, so that all this information can be able to circulate to all the counties, so that each and every hospital can be able to have this table to be able to use them in managing fractures of femur.
Thank you. The other question that is there is how, sorry, let me get that. From Anthony, how do, the process of getting, once you have the innovation, what is the, and you have the idea, you have maybe the first innovation and you've already gotten the innovation, how is the process like to get the registration, or how do you go about registering the device? And in addition to that, how are you able to protect also your ideas, intellectual property in this case?
Thank you, Dr. for that question. Mr. Anton, that is a good question. There are many people who comes with a lot of innovation, and when you come up with any innovation or any idea, it's important to be able to get to know the process. I remember when we came up with this hip spiker table, and also even rest of us that we went to UK, people have various innovation. So there is always a procedure of how to be able to protect. One, when you have an innovation or an idea, and you've come up with it that is a unique, there is always an organization called Kenya National, it's called Intellectual Properties. Kenya National Intellectual Properties, it's called the KIPI. KIPI is one of the organization in Kenya, it's one of the government organization that is able to register, you're able to apply, you're able to give you, even in their website, actually when you go to their website, www.kipi, you'll be able to see their website and be able to guide you. When you have an innovation, you'll be able to apply this innovation, take this information to them, whatever to them, they'll be able to register and be able to protect. So that now that properties or any innovation that would come up, you're able to protect it so that nobody else. Actually, because we've seen so many people who've come up with a brilliant idea, good innovation, and this innovation end up being stolen because you've not protected. But thank God, because when we have these agents called KIPI, they're able to protect. And also after you protect, we have what's called Kenya National Innovation Agent. This is also this is also part of the government that is about that anybody who come up with any innovation, Kenya National Innovation Agents support innovators. You're able to present your innovation to the Kenya National Innovation Agents, so that at least in case of any, maybe participation, any workshop or any training, or even any, like this is actually one that took us to London, Kenya National Innovation Agents. So they support innovators in Kenya. So KIPI is very important, and it's called the Kenya National Innovation Agent, whereby they're able to register, protect. So these are the two bodies if you have an idea or any innovation. Okay, Dr.
Thank you so much for that. We are indeed learning a lot in regards to innovation in the healthcare and how little improvements on the things that we have, or the ideas that we have, how we can fulfill them to become of use to both the healthcare givers and the patients and improve care. Right now, to our participants, for your comments and questions, kindly comment on the Q&A section, and you'll be able to get your questions. We've gone through the hip spiker table that helps pediatric children in the reduction of femur fractures, and we've also gone through innovation in regards to the hand sanitizer and operation of foot-operated hand sanitizer and hand wash station. Maybe Zachariah, you could tell us a little bit about the specific challenges that maybe you encountered when rolling out these innovations. What was what's some of the challenges that you encountered, maybe as a team at a personal level as you are rolling out these innovations?
Thank you, Daktari, and thank you for that question. Of course, in every innovation or anything that anybody comes in, or when you come up with anything, there's always some challenges. And these challenges are always there. So one of the challenge that anybody, or when I came up with this, you see, when you come up with something especially very new thing, not many people impress. So people will be able to see, is this really a challenge? Is this really an innovation? So one, you'll be able to get a challenge from even your own colleagues, from even your own people, your own friends. So one of the challenges you can be able to get from your own people, your own friends, your own even anybody. So the biggest challenge is actually you can be able to get from within or even outside. So that is one of the challenge. You can also get in terms of challenge, even if you want to accelerate, like now you want to implement. So when you implement, if you want to implement something, and maybe you don't have funds, you see, for anything to be able to be implemented, for anything that you be able to want to come up with a result. So a challenge, money is also, our funds is also another thing that is able to either some of these things like innovation that you want to come up. Like now, there are quite a good number of people with a lot of innovation, but because of the funds, become a very big challenge for them to be able to implement. So funds is also maybe collaboration, maybe partnership. Also, there's quite a lot of challenges. There's quite a lot of challenges that really there, that if you want to roll it, you want to come up with an innovation, you want to move this innovation to another level, quite even in terms of materials, in terms of equipment, in terms of even the advance, even you want to get the best in terms of even the probably maybe personnel. So really there is quite a lot of challenges that are there if you really come up with any innovation. Okay, Dr.
Yes, indeed, for it to be a success, we need to press on beyond the challenges and make the right collaborations so that we are able to reach the goal. Thank you for that. And just maybe a last one. How do we have any of the baseline data, any data on this, any papers on this that we can be able to have the before and after, just as you have shown us, the before and after the innovation, how it has helped the patients?
Yeah, thank you, Dr. for that. Data is very important. Since we came up with this innovation, the hip spiker table with an extension traction, I've been able to show you few cases. But so far, when we came up with this, we've done over 600 patients, almost 1,000 patients that we've used using this innovation, and it's an amazing. We have the records. We normally put the records. We normally put the data. We are able to even have the mobile numbers for their parents. We're able to follow up, get the numbers that we've used. We're able actually to follow up. So we have the data, we have the register that's showing all the patients that we've been able to used this spiker table, we've used them. How is this student? Because we are even following even after 5 years. We like to see how the impact. So we have the register, and also we've been able to put the data records in our register, in our data, so that to show us how many patients we've used, they've been able to benefit using this spiker table. So we have the data, Dr.
Thank you for that. We are now coming towards an end of our webinar session for today, whereby we've had a kind of discussion about innovations in health, creative innovative solutions to common day challenges that we face. Thank you for joining us for this session. And even as we wind up, we've had a lot of questions in regards to the CPD points. If you've not yet received your prior CPD points, we'll request you to email cpdpharmacy@gmail.com and knhcpd@gmail.com. We'll now meet on Wednesday. On Wednesday, we are having a session at the same time, 2 to 3:30 p.m., whereby we are going to have the sexual reproductive health context of HIV prevention with Professor Kiare, and another session on Friday on the COVID. Thank you for keeping us. Thank you for keeping us company. Thank you for your questions and your comments. We've had, as Zakaria, we have a lot of comments just thanking you for the information, congratulating you on the innovations, and we really appreciate that. We'll now have you give us your final comments as we wind up.
Thank you for that. My last comment, maybe just to participants, thank you for your participating. Thank you for listening to this. Everyone can become an innovator. Just see a problem, share it, and be able to implement. The biggest thing in most of the institutions or most of the even countries, you see some of these developed countries, they like implementing. So my encouragement or my last word or to encourage is that after you've come up with an idea, share that idea and be able to implement so that now people can be able to see the results. Anyone can become an innovator and anyone can be able to innovate anything. Just see a problem, come up with a solution so that we can now be able to solve our local solution. We no longer need to be importing anything. We can now be able to do quite a number of things for our country. Because you've seen, even the president has been the far front supporting the innovators. So thank you very much, and thank you for listening.
Thank you very much, Zakaria Kimengich. It's been a pleasure having you in this session. Thank you so much to our participants, our attendees, for listening in. We've now come to the end of today's session. Have a lovely afternoon. Thank you.